Welcome to this practical, evidence-informed course on bone hyperplasia, where we explore how both traditional Chinese medicine and Western medicine can work together to address this condition. Bone hyperplasia, often seen as osteophytes or bone spurs, is closely linked to degenerative changes in the joints. Over the next 6 hours, divided into 6 detailed classes and 24 subclasses, we'll cover everything from causes and symptoms to diagnosis, treatment, and prevention. This integrative approach will give you a well-rounded understanding to support effective management of bone hyperplasia. When we talk about bone hyperplasia in this course, we're mainly referring to osteophytes or bone spurs. These are extra bony growths that develop along the edges of bones or around joints. They're often associated with osteoarthritis and the stress placed on tissues over time. You'll commonly see these bone spurs in areas like the knees, spine, heels, hands, and feet. It's important to remember that bone spurs can sometimes be completely silent, causing no symptoms at all. But in other cases, they might lead to pain, stiffness, limited movement, or even nerve-related symptoms. Because of this variability, our clinical focus shouldn't be just on what the X-rays show, but more importantly, on the symptoms the patient is experiencing and their overall function. This approach helps us treat the person, not just an image. This course is designed for a range of healthcare professionals and learners who want to integrate traditional Chinese medicine with Western approaches to bone hyperplasia. It's especially suited for acupuncturists looking to enhance their treatment planning, TCM practitioners who want to deepen their understanding of patterns and herbs, and physiotherapists focused on function and exercise. Manual therapists will benefit from learning about safety and referral processes, while healthcare students can develop their clinical reasoning skills. Even patients themselves can gain valuable knowledge about self-management basics. Overall, this course encourages clinical thinking that is safe, practical, and informed, but it's important to remember that individual medical care should always involve qualified assessment. This 6-hour course on bone hyperplasia integrates both traditional Chinese medicine and Western medicine, organized into 6 clear modules. Each module is broken down into 4 focused subclasses, each lasting about 15 minutes, making the material easy to digest and flexible for online study. We start by building a strong foundation with an understanding of the condition itself. Next, we move into diagnosis and assessment to recognize the issues accurately. Then we explore Western treatment approaches alongside the TCM perspective and pattern differentiation. After that, we dive into TCM treatment methods specifically designed to address bone hyperplasia. Finally, we conclude with real case studies, prevention strategies, and a review to consolidate your learning. This structure allows you to revisit any section with ease before applying it in clinical practice, ensuring a comprehensive grasp of both medical systems. When approaching bone hyperplasia, it's crucial to follow a structured clinical reasoning pathway that integrates both traditional Chinese medicine and Western medicine safely. The process starts not with treatment, but with thorough assessment. First, we identify the patient's symptoms, things like pain, stiffness, range of motion issues, swelling, and any neurological signs. Next, we check for red flags such as weakness, changes in bladder or bowel function, fever, recent trauma, or pain that worsens at night. These signs are important because they could indicate serious underlying problems. Then we move on to effective diagnosis, which involves a detailed clinical assessment. Imaging studies should only be performed when they will actually help clarify the diagnosis. After that, treatment is chosen based on a combination of Western medical care and a traditional Chinese medicine plan tailored to the patient's specific pattern. Finally, prevention is essential to avoid recurrence. This includes focusing on exercise, posture, load management, and overall lifestyle modifications. Remember, the key safety message here is to always refer patients immediately if their symptoms suggest serious pathology or progressive nerve compression. This foundation of recognizing red flags and ensuring accurate diagnosis underpins all safe and effective integrative care. When managing bone hyperplasia, we look through 2 complementary medical lenses: Western medicine and traditional Chinese medicine. From the Western medicine perspective, the focus is on confirming the diagnosis and ruling out any serious underlying conditions. Treatments typically include exercise, weight management, and physiotherapy to improve function. When necessary, medications, injections, or even surgery are used to address symptoms. On the other hand, Traditional Chinese medicine approaches bone hyperplasia by differentiating specific patterns such as kidney deficiency, cold damp bile, or blood stasis. The goal here is to unblock channels, move qi and blood, and relieve pain through therapies like acupuncture, moxibustion, cupping, tuina massage, lifestyle adjustments, and herbal medicine, all applied safely. Ultimately, both approaches share the same patient-centered goal: reducing pain, enhancing movement, and supporting safer long-term self-management. By integrating these perspectives, we can offer more comprehensive care tailored to each patient's needs. By the end of this course, you'll be able to clearly explain what osteophytes, or bone spurs, are from both Western medicine and traditional Chinese medicine perspectives. You'll learn to identify their causes, risk factors, symptoms, and important red flags to watch for. You'll also know when to recommend imaging, referrals, or urgent care to ensure patient safety. Additionally, we'll compare conventional Western treatments with evidence-informed TCM options, helping you design safe, effective treatment plans that include acupuncture, electroacupuncture, moxibustion, cupping, tuina, lifestyle changes, and herbal therapies. Finally, you'll understand how to prevent symptom worsening through proper exercise, posture, load management, and self-care. Throughout, the course stays grounded in evidence, keeps the patient at the center, and focuses on practical, safe approaches. Here we have the key references used for the introduction to bone hyperplasia, combining both traditional Chinese medicine and Western medicine perspectives. These sources provide a solid foundation for the material covered in this course. You'll notice reputable organizations like the Mayo Clinic and Cleveland Clinic, which offer comprehensive overviews of bone spurs, including symptoms, causes, diagnosis, and treatment options. The NHS and NICE guidelines contribute important clinical recommendations, especially regarding osteoarthritis and related conditions like sciatica. Additionally, systematic reviews such as those from Cochrane provide evidence-based insights on acupuncture for osteoarthritis, supporting the integration of alternative therapies. Remember, while this online course is informative, it's not a substitute for personal medical assessment or emergency care. For those pursuing the full 6-hour program, further detailed research and local clinical guidelines will be included to deepen your understanding.